Let's discuss about nutrition. In nutrition, the first nutrient is vitamins. In vitamins, there are two types of vitamins: water soluble vitamins and fat soluble vitamins. In water soluble vitamins, vitamin B complex, vitamin C. In fat soluble vitamins include vitamin A, vitamin D, vitamin E, vitamin K. In vitamin B, the group of 7 water soluble vitamins are there. The first one is thiamine, riboflavin, niacin, pyridoxine, cobalamin, biotin, pantothenic acid, and folic acid. Biotin and pantothenic acid deficiencies are rare as they are found in numerous foods. The biotin deficiency is commonly found in prolonged antibiotic therapy. The vitamin B1 is also called thiamine. The thiamine main sources are yeast, cereals, liver. And function of thiamine, ATP production. The ATP is adenosine triphosphate and it's responsible for cellular energy for cellular function in living organism. The stabilizing the appetite, proper nerve functions. Deficiencies. In deficiency of thiamine causing two conditions, beriberi and Wernicke-Korsakoff syndrome. In beriberi, shortness of breath, poor appetite, weakness, pain in limbs. And Wernicke-Korsakoff syndrome that include vision changes, ataxia, impaired memory. The risk: hemodialysis, diuretics, low intake food and alcoholism. These patients can get thiamine deficiency. And therapeutic usage for the congestive heart failure, cancer prevention and autonomic dysreflexia. Vitamin B2, that is riboflavin and also called yellow respiratory enzyme. The sources are egg, meat, green leafy vegetables, milk. The deficiency is causing itching, burning eye, oily skin, dermatitis, digestive disturbances, cracks and sores in mouth and lips. Risk factors: when a person taking too much of alcohol, cataracts and sickle cell anemia. Vitamin B3, also called niacin. In niacin, main sources are liver, kidney, meat, green leafy vegetables and grain cells. The functions of niacin: energy production, improve the circulation and maintenance of skin, tongue and nervous system. The deficiencies of niacin causing pellagra, irritability, fatigue, insomnia and mental depression. In pellagra patient can see inflamed skin, sore in mouth, dementia and diarrhea. The vitamin B4 is next vitamin that is also called pantothenic acid. The pantothenic acid including the main sources are fruits, meat, poultry and legumes. The main function is produce energy. The vitamin B6 is also called pyridoxine. The pyridoxine sources are meat, egg, green leafy vegetables. The functions: RBC production, nervous system function, immunity, reducing muscle spasm, cramps and numbness, balance of sodium and phosphorus. The deficiency of pyridoxine causing nervousness, insomnia, skin lesions, arms and leg cramps, loss of muscle control and weakness. In vitamin B7, it's also called biotin. In biotin, the main sources are egg yolk, meat, soya beans. The functions: energy production, body chemicals like insulin production, gene expression. The deficiencies causing nausea, anorexia, hallucination and depression. So next one is vitamin B9, that is folic acid. The sources of folic acid is yeast, green leafy vegetables and the function: synthesis of nucleic acid. The deficiency is causing neural tube defect and anemia. And therapeutic use of folic acid is chronic hemolytic anemia. Next vitamin is vitamin B12. It's also called cobalamin. Functions of cobalamin for the nerve function, RBC production, DNA in reproduction, anemia, metabolizing fats and proteins. The deficiency is causing anemia, nerve damage and hypersensitivity. The risk factors of cobalamin deficiency, especially in pernicious anemia. So in case of pernicious anemia, should take regular B12 injections. And also HIV, chronic fatigue syndrome. The vitamin C is the next vitamin, that is ascorbic acid. The sources are fruits, vegetables, tomato and orange juice, sweet potato and also other citrus fruits. The functions: collagen synthesis, body to fight against infection, gum health, prevention of cancer and heart disease. The deficiency is causing scurvy. The scurvy can see bleeding gums, loss of appetite, skin rash and fatigue. And also seen the deficiency lead to slow healing of wound, joint pain, anemia, weight loss. The therapeutic purpose: cardiovascular disease, cataract, diabetes mellitus, cancer, lead toxicity and common cold. The next is vitamin A, retinol or retinoic acid. The main source of vitamin A: fish liver oil, egg yolk, milk, cheese, butter. Provitamin A, carotene. Yellow and dark fruits we can see the provitamin A. The functions of provitamin: normal vision, cartilage and bone growth, immunity against infection, anti-proliferative effect. The deficiencies lead to impaired vision, night blindness, extremely dry skin, hair or nail, the epithelial metaplasia and keratinization, and also seen the xerophthalmia, dry eye. The risk factors of the vitamin A: young children, inadequate health care, children, adult with pancreas, liver and intestinal problems. Then vitamin D, calciferol D2 and cholecalciferol is D3. The main sources of vitamin D: sunlight, milk, fish, orange juice, fortified cereals. The function: calcium phosphorus level in plasma. The metabolic function: bone mineralization, neuromuscular transmission. The deficiency is causing rickets, delayed bone growth, weakness and pain in spine, pelvis and legs. Also can see hypocalcemia, that is tetany. The risk: who will develop vitamin D deficiency? The elderly person, covered and protected skin, the breastfeed infants. Then vitamin E, tocopherol and tocotrinolol. Sources: veg like spinach, carrot, egg, bread, almond, peanuts, veg oils. The function: antioxidant action, platelet aggregation, vasodilatation, then scavenger of free radicals. Deficiency is causing hemolytic anemia, especially in child, impaired coordination and muscle relaxation, and increased risk of cardiovascular disease. The therapeutic use include diabetes mellitus, cancer and cardiovascular disease. Then vitamin K, sources: veg oil, almond, peanut, spinach. Body can produce its own with the help of gut bacteria. Function: clotting, bone mineralization. Deficiency is causing biliary obstruction, hemorrhage, infants. Common in infants. The risk: antibiotic therapy, warfarin, malabsorption. Then kwashiorkor and marasmus. About the kwashiorkor: acute illness or infections, measles, age, trauma, sepsis are some common causes. The protein in principal nutrient in kwashiorkor: 18 months to 3 years, then rapid and acute onset, some weight loss will be there, and high mortality rate. About marasmus: severe prolonged starvation, chronic or recurrent infections. The calorie and protein is principal nutrient, the 6 months to 5 years. Then chronic and slow onset, severe weight loss, low mortality unless related to underlying disease. Treatment, slowly increasing calorie intake through several small meals, the liquid protein supplements if you have problem in digesting food, and multivitamin supplements, medication to improve appetite. The complications including hypoglycemia, hypothermia, hypovolemia, hypovolemic shock, permanent mental and physical disabilities. So the next nutrient is minerals. The minerals are essential for the body to function properly. They help keep bones, muscles, nerves and organs healthy. The type of minerals, first one is macro minerals, needed in large amount, that is greater than 100 milligram per day, including calcium, phosphorus, magnesium, sodium, potassium, chloride and sulfur. The next is trace minerals, needed in smaller amount, that means less than 100 milligram per day, including iron, manganese, copper, iodine, zinc, cobalt, fluoride and selenium. The functions: calcium helps maintain bone density, cell and muscle function and heart health. The magnesium help keep heart rhythm steady and it is a vital component of bone and teeth. Potassium helps regulate blood pressure, heart rhythm and water content in. The next mineral is iron. Helps to form hemoglobin which carries oxygen in the blood. Zinc helps the immune system to fight against illness and infections and help with the cell growth and wound healing. The sodium helps to keep body fluids in balance and is needed for normal muscle and nerve functions. The phosphorus work with calcium to build strong bone and teeth. Excess minerals, too much of any mineral can be dangerous and lead to illnesses. Then sources of minerals. Calcium found in dairy, milk, bones. Calcium help in muscle movement and nerve function. The magnesium found in banana, almond, pumpkin seeds and brown rice, quinoa, spinach, kale and oatmeal. Magnesium play a role in many body functions. About potassium found in many foods. Potassium is necessary for good health and organ. Next is iodine found in seafood, iodized salt, bread and dairy products. Iodine is necessary for the production of thyroid hormone. And next is selenium found in meats, seafood and grains, and selenium is an antioxidant. The next is copper, a necessary part of many enzymes in the body. Copper is needed for the metabolism of iron. The next mineral is fluoride. Fluoride is found in drinking water, fish and most teas. The fluoride assists in the formation of bone and teeth. The chromium found in unrefined foods, brewer's yeast, liver, whole grains, nuts and cheese. The chromium helps in insulin to regulate blood glucose level. The manganese found in berries. Manganese is needed for several metabolic functions related to energy metabolism. Then deficiency of minerals. The deficiencies of minerals. The first one is iron deficiency lead. Iron deficiency anemia which can lead to fatigue, weakness and pale skin. In calcium deficiency can cause osteoporosis, osteopenia and an increased risk of fracture. It can also cause muscle cramps, numbness and tingling in fingers. The zinc deficiency can cause impaired immune function and delayed wound healing and loss of appetite. It can also affect the skin, gastrointestinal tract, brain and central nervous system. Next is iron deficiency can cause goiter and enlarged thyroid gland. Selenium deficiency can cause Kisshan disease and the phosphorus deficiency can cause loss of appetite, anxiety and bad teeth. Magnesium deficiency can cause mental disorders like anxiety, depression and mood swings. It can also cause numbness, loss of appetite, nausea and tingling sensation. And other mineral deficiencies disease include rickets, tetany, hypocalcemia, osteomalacia, vitamin K deficiency, pellagra, and xerophthalmia. The disease-specific diets: congestive heart failure, low sodium, low fat diet; multiple sclerosis, fiber and potassium rich diet; Parkinson's disease, high fiber and protein rich diet; renal stone, low calcium diet; Addison disease, low potassium diet; Cushing syndrome, potassium rich and low sodium diet; pheochromocytoma, low sodium diet; cholecystitis diet; pancreatitis, low fat, protein rich diet; diabetes mellitus, low fat, low carbohydrate diet; hepatitis, carbohydrate rich diet; cirrhosis of liver, low fat, low protein, carbohydrate diet; celiac disease, gluten free diet; GERD, low fat, fiber rich diet; dumping disease or dumping syndrome, high fat, low fiber diet; Meniere's disease, tuberculosis, high calorie, high protein diet; COPD, high calorie, high protein, low fat diet; glomerulonephritis or nephrotic syndrome, low protein, low fat, low sodium diet; fracture, high calorie, high protein diet; digoxin and diuretics, potassium rich diet; hyperparathyroidism, low calcium, phosphorus rich diet; tetany, calcium rich diet; osteoporosis, protein, calcium and vitamin rich diet; gout, low purine diet; renal failure, low protein, low potassium diet; cystic fibrosis, high calorie, high protein diet; stroke, soft diet; colostomy, low fat diet; ulcerative colitis, low residue diet.